Okay, hello everyone. Good afternoon, good evening, good morning, wherever you are around the world. I'm Dr. Dr. Chukwemeka Precious Anyongo. And like I always say, I'm here for you for health care updates that will keep you and your loved ones healthy. It's been a very, hectic day at work today. Today being Wednesday, antenatal clinic. Wow, a lot of pregnant women that we had to see. It's hectic sometimes, but there's joy when you see women being pregnant and they eventually deliver that baby or those babies, and the woman and the baby or her babies are fine and healthy. There's this joy that comes around it. There's this joy that comes to a doctor and even to the family of those who just delivered. So that's what antenatal anyway. But that's not what I want to talk about today. What I want to talk about is something that has been affecting most of us because of the way we see it, but it's actually not the way it is. Now, most Nigerians always think they have typhoid. And it's quite funny. Just yesterday, during clinic hours yesterday, I had to tell about 5 of my patients. Say, sir, I don't think you have typhoid. They'll be like, doctor, I have typhoid and malaria. It's funny. The malaria part may be true, maybe after some tests, but the typhoid part is not as common as most Nigerians see it. You understand? I have to explain to some of them. Sir, if you have typhoid, you actually this and this and this and this are what you have. And when I finish explaining, they'll be like, oh, really? Okay, maybe I don't really have typhoid, and we laugh about it. But then, sincerely, typhoid, like real typhoid, not the Nigerian people's type of typhoid. I'm not making this of Nigerians. Don't mind me, I'm a Nigerian too. But not the way we all think of typhoid. The main typhoid, the real typhoid, it comes with fever. Yes, it comes with fever. That's one of the commonest symptoms in typhoid, and that's why it's even called typhoid fever. The fever is not the type that easily just goes away like that. You understand? Even in the second week of the illness, like from day 10 upwards, the fever may become a step ladder kind of fever. It may get up to 39 to 40 degrees, and it doesn't go back to normal. You understand? And the patient may become very stuporous. Medical term, they use the word toxic. The patient will look toxic, but the patient will look, they'll be malay. The patient will feel like someone is beating him and the rest. Typhoid is really bad. It's not, you can't really even want to walk on your own, most times when it's the main typhoid. There are other symptoms that are associated with typhoid, the constipation that comes with it, and a lot of, anyway, I'm not here to really educate us on the medical, symptomatology of typhoid. I'm just here to tell us what we do that usually lead us to thinking we have typhoid. Number one, most Nigerians run to labs and they do this test they call without test. I don't know if you know without test. Okay, so for you that don't know the name, there's this test you do that the result comes out as 1 over 160, 1 over 320, 1 over 80, or some labs use ratio 1 ratio 80, 1 ratio 150, 160, 1 ratio 320. So that test is called a without test. And without test is not the gold standard, it's not the diagnostic test for typhoid. So if you have done it several times, no matter what they tell you about you having typhoid, you may not actually have typhoid from without test. So there are other tests we recommend medically for the treatment of typhoid. Number 1, blood culture. 2, stool culture. 3, urine culture. Then, some can go as far as bone marrow aspirate. Although it's painful, we rarely send for that, except it becomes necessary and there's no other way to get those either blood, urine, or stool culture samples. Then, some doctors may want to include full blood count to associate, just to add flesh to a diagnosis. But you see, these first four I called, the blood culture, the stool culture, the urine culture, they are actually the test we use to actually confirm whether there's actually typhoid. And by confirming, you want to check the organism that is causing the typhoid, the salmonella species, that are salmonella typhi and the other species causing the typhoid. So if you culture them and they're in the blood or in the stool or in the urine, of course, confirms typhoid. You understand? But not without. Please, not without. I'm saying it again. So, most people after they've taken anti-malaria, of course, we know we're in malaria endemic regions, being that we're in sub-Saharan Africa and West Africa and also Nigeria, we're in malaria endemic region. So most people, after treating their malaria, and they still feel sick. Some begin to feel like, I think it's typhoid now. I just finished treating the malaria. I think now it's the typhoid that is disturbing me. It is, most times it is not true. Sometimes some people, it is either it is a poorly treated malaria, it is either it is a recrudescent malaria, although that's the topic for another day anyway, or it may not have to do with the malaria at all. It may just be that the patient has not been having adequate rest and adequate sleep. Rest and sleep are as important as water and food. Yes. Some people sleep late in the night because maybe they're either trying to catch up with a movie, a program, trying to, do some online-ish things, in the night, or their social media is keeping them busy till very late. When I say late, some stay up to 1, 2 a.m. and they have to still wake up around 5 or 6 and still go to work. If you keep living that kind of life, you will feel sick even when you're not sick, and you will easily fall sick. Do you know why? Because you'll be easily stressed, and studies have proven that increase in stress reduces your immunity to a level, and once your immune response are not very strong, you will easily fall down or come down with illnesses. So sometimes it's not like you have typhoid. It could just be some other things, maybe the stress, the poor sleep, or still the malaria, or something else. Or it could just be a respiratory tract infection or something else, but not typhoid. However, if you think you have typhoid, go to a doctor. Let them be the one to diagnose the typhoid. Let them be the one to tell you that you have typhoid after doing some necessary investigations like either the blood culture, stool culture, or urine culture. And I know why some labs do this readout test for you. I'll tell you why. Most times, I don't even blame them too much. You already go to them that you have typhoid, and they have to prove to you that you have typhoid that day. And this culture test I called blood culture, stool culture, or urine culture, the result does not come out that same day when they take your sample. It comes out some after 48 hours, some after 24, some after 72 hours, depending on the culture media they use and how it is being cultured. So you can't get a result that day. It can't be confirmed that day. But these labs feel that you are so anxious, you need you need your result now. So they give you the one way you want. If you get now, you understand. Or I'm not supporting them. I'm not saying, and I'm not castigating them. Not as if they are doing what it's what was done before in those days. But now, new studies have come to show that why that does not really give much information about whether a person has typhoid or not. So please, if you think you have typhoid, see a doctor first and get diagnosed properly so you know whether it is typhoid or not. However, I just hope this has enlightened you better, and you will not keep taking antibiotics too much, so that we will not create an antibiotic resistance in our community. I'll talk about that some other days. There are a lot of topics to talk about, but I hope this has helped you. In case you have any question, any comment, any more clarification, you can go to the comment section and reply your comments as soon as possible. And also, you can, if you have not subscribed to my YouTube channel for more of this, you subscribe to my YouTube channel. I'm going to make the YouTube handle available to you, and share this information so that your loved ones, your friends, your family, everyone around you, those that you love, will get to see this video and also get to learn just the way you have learned. And we are also learning. Even myself, I'm still learning. I'm not perfect. And I hope to see you guys next time. Have a lovely time and God bless.